What are the key considerations in managing a patient with major depressive disorder who is being started on an SSRI? Discuss the role of patient education in this process. Answer: when managing a patient with major depressive disorder (MDD) starting on a selective serotonin reuptake inhibitor (SRI), key considerations include assessment of symptoms and history. Evaluate the severity of depressive symptoms, prior treatment history, and comorbid conditions. Understanding the patient's background aids in tailoring treatment. Informed consent. Explain the mechanism of action, expected benefits, potential side effects, and the duration of treatment. Informed consent is crucial, ensuring the patient understands their treatment plan. American Psychiatric Association. Patient education. Educate the patient about the importance of adherence to medication, the time frame for symptom improvement, usually 4-6 weeks, and the significance of not discontinuing the medication abruptly to avoid withdrawal symptoms. Monitoring. Schedule follow-up appointments to assess the patient's response to treatment and manage any side effects. The American Psychiatric Association recommends regular monitoring during the initial phase of treatment. Crisis management. Assess and educate about suicidal thoughts or behaviors, especially during the initial weeks of treatment. Use standardized tools such as the Columbia Suicide Severity Rating Scale (ERS) for ongoing risk assessment. Legal and ethical considerations. Be aware of ethical obligations regarding patient confidentiality and the duty to warn if the patient poses a risk to themselves or others. By addressing these considerations, APRNS can ensure a comprehensive and effective management plan for patients with MDD. Mr. Smith, a 72-year-old male, presents with signs of polypharmacy, including dizziness and confusion. What steps should the APRN take to address these issues? Answer: to address Mr. Smith's issues related to polypharmacy, the APRN should take the following steps. Medication review. Conduct a comprehensive medication review, including prescription medications, over-the-counter drugs, and supplements. Use tools such as the Beers criteria to identify potentially inappropriate medications for older adults. Assess side effects. Evaluate the side effects of each medication and assess their potential contribution to Mr. Smith's dizziness and confusion. The APRN should inquire about the onset of symptoms in relation to medication changes. Medication reconciliation. Perform medication reconciliation at each visit to ensure accuracy in the medication list and avoid discrepancies that could lead to adverse effects. Collaborate with pharmacists. Consult with a clinical pharmacist specializing in geriatrics for recommendations on medication management, especially regarding drug interactions and alternatives. Educate the patient and caregivers. Provide education on the importance of adhering to prescribed medications, recognizing side effects, and understanding the purpose of each medication. Include caregivers in this discussion to ensure they can assist in monitoring Mr. Smith. Regular follow-up. Establish a follow-up schedule to reassess Mr. Smith's symptoms and medication efficacy. Continuous monitoring is vital to prevent complications related to polypharmacy. Legal and ethical guidelines. Ensure compliance with the American Geriatric Society guidelines on the management of polypharmacy and ethical obligations to prioritize patient safety. By systematically addressing polypharmacy, the APRN can enhance Mr. Smith's overall health and reduce the risk of medication-related complications. What ethical considerations should be taken into account when providing KTTU patients, particularly regarding gender-affirming treatments? Answer: when providing care to TTU patients, especially regarding gender-affirming treatments, the following ethical considerations must be addressed. Respect for autonomy. Recognize the patient's right to make informed decisions regarding their healthcare. Ensure they are fully informed about the risks, benefits, and alternatives of gender-affirming treatments. Informed consent. Obtain informed consent that includes discussions about the implications of treatments, potential side effects, and the patient's expectations. The World Professional Association for Transgender Health (WD) emphasizes the need for thorough informed consent processes. Cultural competence. Develop cultural competence to understand the unique needs and challenges faced by LGBTQ individuals. Engage in ongoing education about gender diversity and the nuances of gender-affirming care. Non-discrimination. Adhere to legal protections against discrimination based on sexual orientation and gender identity, as outlined in the Affordable Care Act. Be aware of state and federal laws that protect LGBTQ rights in healthcare settings. Support systems. Facilitate access to support systems, including mental health services and community resources, which are essential for the holistic care of LGBTQ patients undergoing gender-affirming treatments. Confidentiality. Maintain strict confidentiality regarding a patient's gender identity and sexual orientation, as breaches can lead to significant emotional and psychological harm. Advocacy. Act as an advocate for LGBTQ patients within the healthcare system, addressing barriers to care and promoting policies that support equitable treatment. By considering these ethical principles, APRNS can provide respectful and effective care to LGBTQ patients seeking gender-affirming treatments. How does the APRN integrate trauma-informed care principles in managing patients with PTSD? Answer: integrating trauma-informed care principles in managing patients with post-traumatic stress disorder (PTSD) involves several key strategies. Safety and trustworthiness. Create a safe environment where patients feel secure in disclosing traumatic experiences. Establishing trust is essential for effective treatment. Collaboration. Encourage patient collaboration in treatment planning. Empowerment. Focus on patient strengths and resilience rather than solely on the symptoms of PTSD. This approach enhances self-efficacy and promotes recovery. Cultural, historical, and gender issues. Be sensitive to cultural and gender-specific factors that may influence the patient's experience of trauma. Tailor interventions to address these diverse needs following the guidelines from the Substance Abuse and Mental Health Services Administration (SAMHSA). Understanding trauma's impact. Recognize the widespread impact of trauma on individuals and its potential effects on physical and mental health. Avoiding re-traumatization. Be cautious to avoid practices that may inadvertently trigger trauma responses. Use evidence-based interventions such as eye movement desensitization and reprocessing (EMDR) or cognitive behavioral therapy (CBT). Explain the role of family and group therapy in the management of substance abuse disorders. What are the key therapeutic elements that enhance treatment outcomes? Answer: family and group therapy play a critical role in managing substance abuse disorders by providing support, promoting accountability, and fostering communication among individuals affected by addiction. Key therapeutic elements that enhance treatment outcomes include supportive environment. Both family and group therapy offer a safe space for individuals to share experiences and feelings without judgment. This environment encourages openness and honesty, which are essential for recovery. Education. Providing education about addiction, its effects on individuals and families, and the recovery process is crucial. This knowledge empowers family members and group participants to understand the challenges of addiction better. Improved communication. Therapy sessions promote effective communication skills, enabling family members to express their thoughts and feelings constructively. Learning to communicate can reduce conflict and improve relationships. Accountability and responsibility. In a group setting, individuals are held accountable for their actions and decisions. This accountability fosters responsibility and encourages individuals to remain committed to their recovery journey. Coping strategies. Therapy provides participants with coping strategies to deal with triggers and stresses associated with substance use. Skills learned in therapy can be applied in real-life situations to prevent relapse. Peer support. Group therapy allows individuals to connect with peers who have similar experiences. This shared understanding can enhance motivation and decrease feelings of isolation. Family dynamics. Family therapy addresses dysfunctional dynamics that may contribute to substance abuse. Understanding these patterns can facilitate healing and improve overall family functioning. Relapse prevention. Both family and group therapy focus on relapse prevention strategies, preparing individuals to navigate potential challenges in their recovery journey. By incorporating these therapeutic elements, APRNS can significantly enhance the effectiveness of treatment for substance abuse disorders, promoting lasting recovery. Discuss the importance of culturally competent care in the management of pediatric patients with chronic illnesses. How can APRNS effectively implement these principles? Answer: culturally competent care is crucial in managing pediatric patients with chronic illnesses due to the diverse backgrounds and needs of patients. Key aspects of culturally competent care include cultural awareness. Recognize the influence of cultural beliefs, practices, and values on health behaviors and perceptions of illness. Understanding these factors allows APRNS to tailor interventions to meet individual needs. Effective communication. Use culturally appropriate communication styles, avoiding jargon that may confuse patients or families. Utilize interpreters if necessary to ensure clear understanding, adhering to the national standards for culturally and linguistically appropriate services in healthcare. Clause. Family involvement. Involve family members in care decisions, respecting their roles in the patient's life. This collaboration ensures that treatment plans align with cultural values and preferences. Holistic approach. address not only the medical aspects of chronic illness, but also the social, emotional, and cultural factors that affect the patient's well-being. Consider alternative therapies and beliefs that may complement traditional medical approaches. Education and resources. Provide education that is culturally sensitive and accessible. Develop educational materials that reflect the cultural backgrounds of the patient population and include community resources that can support families. Continuing education. Engage in ongoing training and education on cultural competence to enhance understanding and sensitivity to the diverse populations served. Advocacy. Advocate for policies that promote culturally competent care within healthcare settings. Address systemic barriers that may impact access to care for marginalized communities. By implementing these principles, APRNS can improve health outcomes for pediatric patients with chronic illnesses, ensuring care is respectful, relevant, and effective. What strategies should APRN use to promote adherence to treatment plans among patients with chronic conditions? Answer: to promote adherence to treatment plans among patients with chronic conditions, APRNS can employ several effective strategies. Patient education. Provide comprehensive education about the condition, treatment options, and the importance of adherence. Use teach-back methods to ensure understanding. Collaborative goal setting. Engage patients in setting realistic and achievable goals. Collaboration enhances ownership of the treatment plan, increasing the likelihood of adherence. Simplify regimens. Whenever possible, simplify medication regimens to reduce complexity. Use combination therapies or once-daily dosing to improve adherence. Utilize technology. Encourage the use of mobile health applications and reminder systems to help patients track medications and appointments. Technology can facilitate adherence by providing timely reminders. Support systems. Encourage patients to involve family and friends in their treatment plans for additional support. Social support can significantly influence adherence behaviors. Motivational interviewing. Use motivational interviewing techniques to explore and resolve ambivalence about adherence. This patient-centered approach encourages patients to identify their own motivations for following the treatment plan. Regular follow-up. Schedule regular follow-up appointments to monitor progress, address concerns, and adjust treatment plans as necessary. Consistent engagement helps reinforce the importance of adherence. Address barriers. Identify and address barriers to adherence, such as cost, side effects, or lack of transportation. Working with patients to find solutions can enhance adherence. By implementing these strategies, APRNS can effectively promote adherence to treatment plans among patients with chronic conditions, leading to better health outcomes. Explain the significance of advanced directives and how APRNS can assist patients in understanding and completing them. Answer: advanced directives are legal documents that outline a patient's preferences for medical treatment in the event they are unable to communicate their wishes. The significance of advanced directives includes patient autonomy. Advanced directives empower patients to maintain control over their medical care, ensuring their preferences are respected even when they cannot voice them. Guiding care decisions. These documents guide healthcare providers in making decisions that align with the patient's wishes, particularly in critical care situations. This can help avoid unnecessary or unwanted interventions, reducing family burden. By clarifying preferences, advanced directives can alleviate the emotional burden on family members during difficult decision-making situations. Legal protection. Advanced directives provide legal documentation of a patient's wishes, protecting healthcare providers and families from potential conflicts regarding treatment options. To assist patients in understanding and completing advanced directives, APRNS can educate patients. Provide clear information about what advanced directives are, their purpose, and the types of decisions they cover, including resuscitation preferences and end-of-life care. Facilitate discussion. Create a supportive environment for discussions about values, beliefs, and preferences regarding medical treatment. Encourage patients to talk about their wishes with family members. Assist with documentation. Help patients complete the necessary forms and ensure they understand the implications of their choices. Provide templates or resources that clarify state-specific laws regarding advanced directives. Review regularly. Encourage patients to review and update their advanced directives periodically or after significant life changes, such as a diagnosis of a chronic illness. Collaborate with legal resources. If needed, refer patients to legal resources or patient advocacy organizations that can assist in understanding and completing advanced directives. By promoting the use of advanced directives, APRNS can enhance patient autonomy and ensure that care aligns with individual preferences. What are the critical components of a comprehensive diabetes management plan, and how can a PINS ensure effective implementation? Answer: A comprehensive diabetes management plan includes several critical components to effectively manage the condition. Blood glucose monitoring. Establish a regular monitoring schedule based on individual treatment goals. Education on proper techniques for self-monitoring is essential. Medication management. Develop a medication regimen that may include insulin, oral hypoglycemics, or other agents. APRNS would educate patients about the mechanism of action, dosages, and potential side effects. Nutritional education. Provide dietary counseling tailored to the patient's preferences and lifestyle. Include education on carbohydrate counting, meal planning, and understanding food labels. Physical activity. Encourage regular physical activity tailored to the patient's abilities and preferences. Set achievable fitness goals and educate on the importance of exercise in managing blood glucose levels. Routine health screenings. Schedule regular screenings for complications associated with diabetes, including foot exams, eye exams, and laboratory tests for kidney function and cholesterol levels. Patient education. Provide comprehensive education about diabetes, including its pathophysiology, complications, and self-management strategies. Use teach-back methods to confirm understanding. Goal setting. Collaboratively set realistic and achievable goals for blood glucose levels, weight management, and lifestyle changes. Monitor progress regularly and adjust the plan as needed. To ensure effective implementation, APRNS can create a structured follow-up plan, schedule regular follow-ups to assess progress, reinforce education and make necessary adjustments to the management plan, utilize technology, encourage the use of diabetes management apps or continuous glucose monitors to enhance self-management and facilitate communication between the patient and provider, encourage support groups, recommend participation in diabetes support groups for social support and shared learning experiences, collaborate with interdisciplinary teams, work with dietitians, endocrinologists, and diabetes educators to provide comprehensive care that addresses all aspects of diabetes management. Discuss the role of the APRN in addressing health disparities among vulnerable populations. What strategies can be employed to reduce these disparities? Answer: the role of the APRN in addressing health disparities among vulnerable populations includes advocacy, education, and the provision of culturally competent care. Strategies to reduce these disparities encompass community engagement. Collaborate with community organizations to understand the unique needs and barriers faced by vulnerable populations. Engage in outreach efforts to build trust within these communities. Culturally competent care. Provide culturally sensitive care that respects diverse backgrounds and addresses social determinants of health. Continuous education on cultural competencies essential for effective service delivery. Health education. Develop and deliver health education programs tailored to the specific needs of vulnerable populations. Use plain language and accessible materials to enhance understanding, access to care. Advocate for policies that improve access to healthcare services, including transportation, affordability, and availability of services in underserved areas. Utilize technology. Leverage telehealth services to reach patients in remote areas or those with mobility issues, ensuring continuity of care and access to health resources. Policy advocacy. Engage in advocacy efforts to influence health policy at local, state, and national levels. Work to address systemic issues contributing to health disparities, such as socioeconomic inequalities and discrimination. Data collection and research. Participate in research initiatives to identify and address specific health disparities within vulnerable populations. Collect data to evaluate the effectiveness of interventions and guide future practices. Interdisciplinary collaboration. Collaborate with other healthcare professionals, social workers, and public health organizations to create comprehensive strategies that address the multifaceted nature of health disparities. By employing these strategies, the APRNS can play a significant role in reducing health disparities and promoting equitable health outcomes for vulnerable populations. Explain the role of advanced cardiac life support (ACLS) in the management of cardiac arrest. What are the critical interventions that a nurse must perform during a code situation, and what guidelines govern these practices? Answer: ACLS is a critical intervention protocol aimed at the immediate management of patients experiencing cardiac arrest and other cardiovascular emergencies. The key interventions include early defibrillation. Using an automated external defibrillator within minutes of cardiac arrest is crucial as it increases survival rates. Guidelines from the American Heart Association recommend defibrillation as soon as the rhythm is identified as shockable, e.g. ventricular fibrillation or pulseless ventricular tachycardia. High-quality CPR. Performing high-quality cardiopulmonary resuscitation (CPR) is essential. This includes compressions, at least 1.0-1.2 compressions per minute at a depth of 2.4 inches, ventilations, a ratio of 30:2 for adult CPR, minimizing interruptions. Minimizing interruptions in chest compressions is emphasized in ACLS protocols. Medication administration. Administering medications such as epinephrine 1 mg every 3-5 minutes and amiodarone for recurrent ventricular fibrillation must follow ACLS guidelines. Post-cardiac arrest care. Addressing critical factors such as optimizing ventilation and oxygenation, maintaining hemodynamic stability, and considering targeted temperature management to improve neurologic outcomes. The AHA guidelines provide the evidence-based framework for these practices, ensuring that nurses and healthcare providers can effectively respond to cardiac emergencies. What are the implications of the Nurse Practice Act for APNs, and how does it differ from general nursing practice? Answer: the Nurse Practice Act (NPA) is a set of laws that regulate the practice of nursing within each state, defining the scope of practice for nurses, including APNs. Key implications for APRNs include: scope of practice. APRNs have an expanded scope of practice that may include diagnosing conditions, prescribing medications, and providing a wider range of treatments compared to RNs. The NPA delineates these roles, ensuring APRNs operate within their legal boundaries. Autonomy. Many states grant APRN a degree of autonomy in practice, allowing them to operate independently or in collaborative practice agreements with physicians. This differs significantly from RNs, who typically practice under the supervision of a physician or nurse manager. Licensing and certification. The NPA outlines the educational and clinical requirements for licensure as an APRN, including advanced degrees and national certification in a specialty area. Compliance with these regulations is crucial for legal practice. Disciplinary actions. The NPA provides the framework for disciplinary actions against APRNs who violate nursing laws or standards of practice, including malpractice, fraud, or substance abuse. Mr. Smith is a 62-year-old patient with a history of hypertension and diabetes presenting with chest pain. As the APRN, what immediate actions should you take, and which legal considerations must you keep in mind during your assessment and intervention? Answer: upon Mr. Smith's presentation, the following immediate actions should be taken. Initial assessment. Conduct a rapid assessment using the ABCS, airway, breathing, circulation. Obtain vital signs including blood pressure, heart rate, and oxygen saturation. Patient history. Gather a thorough medical history focusing on the chest pain, e.g. onset, duration, quality, radiation, associated symptoms, the CG and laboratory tests. Perform an ECG to identify any arrhythmias or signs of myocardial ischemia. Order laboratory tests including cardiac enzymes, troponins, electrolytes, and a complete blood count. Immediate interventions. Administer oxygen if oxygen saturation is below 94%. Consider nitroglycerin for chest pain, monitoring for potential hypotension. Legal considerations. Informed consent. While emergent situations may limit the ability to obtain consent, it's crucial to document the circumstances and any verbal consent obtained. Duty to act. As an APRN, there is a legal obligation to provide care to Mr. Smith, and failure to do so could result in legal liability. Documentation. Accurate and timely documentation of all assessments, interventions, and patient responses is vital for legal protection and continuity of care. Understanding the legal framework helps ensure compliance with standards of care while providing effective patient management. Discuss the role of evidence-based practice in nursing, and explain how a PRNS can implement a BP to improve patient outcomes. Answer: evidence-based practice is the integration of clinical expertise, patient values, and the best available evidence into the decision-making process for patient care. The role of a BP in nursing includes improving patient outcomes. BP facilitates the use of interventions that have been scientifically proven to be effective, leading to improved patient outcomes and satisfaction. Guiding clinical decision-making. By applying the best available evidence, APRNs can make informed decisions that enhance the quality of care provided to patients. Continuous professional development. BP encourages APRNs to stay updated on the latest research and guidelines, fostering a culture of lifelong learning. Implementation steps. Formulate a clinical question. Use the PICO, Population Intervention Comparison Outcome Framework, to define the clinical question. Conduct literature review. Systematically search for relevant studies, guidelines, and reviews that address the clinical question. Praise the evidence. Critically evaluate the quality and applicability of the evidence to ensure it meets the necessary standards for practice, integrate findings into practice, collaborate with the healthcare team to implement evidence-based interventions while considering patient preferences and clinical circumstances, evaluate outcomes, assess the impact of the implemented interventions on patient outcomes and modify practices as necessary based on the results. The integration of BP into nursing practice is supported by various professional organizations, including the American Association of Nurse Practitioners, which provides resources for APRNs to enhance their practice. Explain the importance of telehealth in advanced nursing practice and discuss the regulatory considerations that APRNs must navigate when providing telehealth services. Answer: telehealth has become a vital component of advanced nursing practice, enabling APRNs to deliver care remotely and improve access for patients. Its importance lies in access to care. Telehealth reduces geographical barriers, allowing patients in rural or underserved areas to access specialized care. Efficiency and cost-effectiveness. Remote consultations can decrease travel time and associated costs for patients while maintaining high-quality care. Continuity of care. Telehealth facilitates ongoing management of chronic conditions, ensuring patients receive consistent follow-up and support. Regulatory considerations. State licensure. APRNs must be licensed in the state where the patient is located during the telehealth encounter, which may require understanding interstate practice regulations. Reimbursement policies. Understanding the reimbursement policies of Medicare, Medicaid, and private insurers is essential, as coverage for telehealth services can vary significantly. Patient privacy. Compliance with the Health Insurance Portability and Accountability Act (HIPAA) is critical to ensure patient privacy and security during telehealth consultations. How can APRNs utilize quality improvement (QI) initiatives to enhance patient safety in their practice settings? Answer: quality improvement (QI) initiatives are essential for enhancing patient safety in healthcare settings. APRNs can utilize these initiatives by identifying areas for improvement. APRNs can analyze patient outcomes, incident reports, and feedback to identify specific areas needing improvement. Developing QI projects. Once a need is identified, APRNs can lead or participate in QI projects aimed at improving processes such as reducing medication errors, enhancing discharge planning, or improving communication among the healthcare team. Implementing evidence-based strategies. Incorporating evidence-based practices into QI initiatives is crucial. For example, using standardized protocols for medication administration can minimize errors. Monitoring and evaluating outcomes. Implementing performance metrics to track the effectiveness of QI initiatives is vital. Promoting a culture of safety. APRNs can advocate for a culture of safety within their organizations by encouraging open communication, reporting errors without fear of retribution, and fostering teamwork. Mr. Johnson is a 45-year-old male diagnosed with type 2 diabetes mellitus. He expresses concerns about managing his condition and is seeking advice on lifestyle modifications. As the APRN, what evidence-based recommendations would you provide? Answer: for Mr. Johnson, the following evidence-based recommendations can be provided to effectively manage type 2 diabetes mellitus through lifestyle modifications. Dietary changes. Balanced diet. Encourage a diet rich in whole grains, fruits, vegetables, lean proteins, and healthy fats. The American Diabetes Association (ADA) recommends the Mediterranean diet for its cardiovascular benefits. Carbohydrate monitoring. Advise on carbohydrate counting or the plate method to manage blood glucose levels effectively. Physical activity. Regular exercise. Recommend at least 150 minutes of moderate intensity aerobic activity per week, combined with strength training at least twice a week. Regular exercise can improve insulin sensitivity and aid in weight management. Achieving a healthy weight. For overweight or obese patients, even a modest weight loss of 5.10% can significantly improve glycemic control and reduce the risk of complications. Blood sugar monitoring. Self-monitoring. Educate on the importance of regular blood glucose monitoring to understand how diet and exercise affect his glucose levels. Behavioral support. Support programs. Suggest participation in diabetes education programs or support groups to enhance motivation and provide strategies for managing the condition. Regular follow-up. Healthcare visits. Encourage regular follow-ups with healthcare providers to monitor diabetes management, including routine screenings for complications. These recommendations align with guidelines from the ADA and the Centers for Disease Control and Prevention (CDC) and empower Mr. Johnson to take an active role in managing his diabetes effectively. Describe the ethical considerations that APRNS must navigate in the context of end-of-life care. How do these considerations affect decision-making for patients and families? Answer: end-of-life care involves complex ethical considerations that APRNS must navigate, including autonomy. Respecting the patient's autonomy is paramount. APRNS should support patients' rights to make informed decisions about their care, including advanced directives and do not resuscitate DNR orders. Beneficence and non-maleficence. The principles of beneficence acting in the patient's best interest and non-maleficence avoiding harm guide APRNS in providing appropriate interventions that enhance quality of life while minimizing suffering. Justice, ensuring equitable access to palliative care and resources for all patients, regardless of background, is critical. This includes addressing disparities in healthcare access and treatment options. Communication. Open and honest communication with patients and their families is essential in discussing prognosis, treatment options, and goals of care. This helps facilitate shared decision-making and aligns treatment with the patient's values and wishes. Family involvement. Considering the family's wishes and emotional needs is vital. APRNS should provide support to families as they navigate difficult decisions and help them understand the patient's condition and choices. These ethical considerations significantly impact decision-making processes, emphasizing the need for a compassionate, patient-centered approach that aligns with the values and preferences of patients and their families. Discuss the significance of cultural competence in advanced nursing practice. How can APRNS develop cultural competence in their practice? Answer: cultural competence is essential in advanced nursing practice as it enhances the quality of care provided to diverse populations. Its significance includes improved patient outcomes. Culturally competent care leads to better patient understanding, adherence to treatment plans, and overall satisfaction, ultimately improving health outcomes. Reduction of health disparities. Cultural competence allows APRNS to address and reduce health disparities by understanding the unique needs and barriers faced by various cultural groups. Enhanced communication. Effective communication with patients from diverse backgrounds fosters trust and rapport, which is vital for successful healthcare interactions. Developing cultural competence, education and training. Participate in ongoing education and training focused on cultural competence and diversity in healthcare. This may include workshops, seminars, and online courses. Self-reflection. Engage in self-reflection to understand personal biases, beliefs, and assumptions. Recognizing these factors can enhance awareness of how they affect patient interactions. Community engagement. Collaborate with community organizations to understand the cultural context of the population served. This can provide insights into specific needs and health beliefs. Utilize interpreter services. When language barriers exist, utilize professional interpreter services to ensure effective communication and understanding of health information. By actively pursuing cultural competence, APRNS can provide more equitable and effective care, addressing the diverse needs of their patient populations. Analyze the impact of health policy on nursing practice and the implications for APRNS in their roles as advocates for patients and healthcare reform. Answer: health policy significantly impacts nursing practice, particularly for APRNS who serve as advocates for patients and healthcare reform. Key impacts include scope of practice regulations. Health policy shape the regulatory environment in which APRNS operate, defining the scope of practice, prescriptive authority, and ability to practice independently, access to care. Policies influencing healthcare access, such as insurance coverage, reimbursement rates, and provider shortages, directly affect APRN's ability to deliver care to their patients. Quality of care standards. Health policies set standards for quality care, affecting APRN's practice environments and the quality improvement initiatives they can implement. Implications for APRN's advocacy role. APRNS must engage in advocacy efforts to influence health policy decisions, addressing issues such as access to care, healthcare disparities, and reimbursement for services. This can be done through participation in professional organizations, lobbying efforts, and public health initiatives. Staying informed. Keeping abreast of health policy changes and their implications for nursing practice is vital. This includes understanding local, state, and federal regulations that impact patient care and nursing roles. Leadership opportunities. APRNS would seek leadership roles in healthcare organizations and policy-making bodies to ensure that nursing perspectives and patient needs are represented in policy discussions. By actively participating in health policy discussions and reforms, APRNS can enhance their roles as leaders and advocates in the healthcare system, ultimately improving patient outcomes and access to quality care. What is the role of social determinants of health in shaping health outcomes, and how can advanced practice registered nurses (APNs) address health disparities in their practice? Answer: social determinants of health (ESTO) encompass various factors, including socioeconomic status, education, neighborhood and physical environment, employment, social support networks, as well as access to healthcare. They significantly influence health outcomes by determining the conditions in which people are born, live, learn, work, and play. APRNS can address health disparities by conducting comprehensive assessments. APRNS would assess the SDOH of their patients to identify barriers to health advocacy, advocating for policies that address these determinants at community and policy levels. Community engagement, collaborating with community organizations to promote health education and access to resources. Culturally competent care, providing culturally appropriate interventions that consider patients' backgrounds and experiences. Policy development, engaging in health policy development to reduce systemic barriers and improve healthcare access. Describe the steps involved in the development and implementation of practice guidelines in nursing. What are the key factors that influence this process? Answer: the development and implementation of practice guidelines in nursing involves several critical steps: identifying the need, assessing current clinical practices and identifying areas for improvement or standardization, reviewing evidence, conducting a systematic review of existing literature and research to inform the guidelines, formulating recommendations, developing clear, actionable recommendations based on the evidence gathered, stakeholder involvement, engaging stakeholders including healthcare providers, patients, and policymakers to ensure relevance and applicability, pilot testing, implementing the guidelines in a controlled setting to evaluate their effectiveness and gather feedback, dissemination, sharing the guidelines widely through professional organizations, journals, and conferences. Evaluation, continuously assessing the impact of the guidelines on clinical practice and patient outcomes, making revisions as necessary. Key influencing factors: quality of evidence, the robustness and applicability of the research informing the guidelines, healthcare environment, organizational culture and readiness for change, regulatory requirements, compliance with state and federal regulations impacting clinical practice, relevant guidelines. The Institute of Medicine (IM) emphasizes the importance of evidence-based practice in healthcare, while the American Nurses Association (ANA) provides standards for the development and implementation of practice guidelines. What are the main components of a community health assessment chart, and how can a PRNS use this tool to improve population health outcomes? Answer: a community health assessment chart is a systematic process that identifies community health needs and assets. The main components include data collection, gathering quantitative and qualitative data on health indicators, demographics, and resources available within the community. Community engagement, involving community members in the assessment process to gain insights and foster ownership of health initiatives. Analysis of findings, evaluating the data to identify health trends, disparities, and priority health issues affecting the community. Action planning, developing strategies and interventions based on the assessment findings to address identified health needs, evaluation and monitoring. Establishing metrics to measure the effectiveness of implemented strategies over time. A PRNS can use CHs to improve population health outcomes by tailoring interventions to meet the specific health needs of the community, fostering collaboration with local agencies and organizations to enhance resource utilization, advocating for policies and funding that address the root causes of health disparities. Mr. Adams is a 62-year-old patient with multiple chronic conditions, including diabetes and hypertension. He expresses concerns about managing his health due to a lack of understanding of his medications and diet. As an APRN, what strategies can you implement to facilitate Mr. Adams' health behavior change? Answer: to facilitate Mr. Adams' health behavior change, an APRN can implement the following strategies. Patient education. Provide comprehensive education about his medications, including their purposes, dosages, and potential side effects, and how they relate to his chronic conditions. Motivational interviewing. Use motivational interviewing techniques to engage Mr. Adams in discussions about his health goals, addressing any ambivalence he may have toward making changes. Behavioral contracts. Develop a behavior change contract with clear, achievable goals and timelines to help Mr. Adams stay accountable. Support systems. Encourage the involvement of family members or caregivers to support him in adhering to his treatment plan. Follow-up and monitoring. Schedule regular follow-ups to monitor his progress, provide encouragement, and make necessary adjustments to his care plan. How can APRNS incorporate evidence-based practice (EP) into their clinical decision-making process, and what barriers might they encounter in this implementation? Answer: APRNS can incorporate evidence-based practice into their clinical decision-making process through the following steps. Ask. Formulate a clear clinical question based on patient needs. E.g., using the PICO format. Patient intervention comparison outcome. Conduct a thorough search of current literature and guidelines to find relevant evidence. Appraise, critically evaluate the quality and applicability of the evidence gathered. Apply, integrate the evidence with clinical expertise and patient preferences to make informed decisions. Assess, evaluate the outcomes of the implemented decisions to inform future practice. Barriers to implementation: limited access to resources, inadequate access to research databases and current literature, time constraints. Heavy workloads may limit the time available for BP research and application. Resistance to change. Organizational culture may resist new evidence-based practices. What are the ethical considerations that APRNS must address when conducting research involving human subjects? Answer: when conducting research involving human subjects, APRNS must address several ethical considerations. Informed consent, ensuring that participants fully understand the research purpose, procedures, risks, and benefits before agreeing to participate. Confidentiality, protecting participants' personal and health information to maintain privacy throughout the research process. Beneficence, striving to maximize benefits while minimizing potential harm to participants. Justice, ensuring equitable selection of participants, avoiding exploitation of vulnerable populations. Approval from institutional review boards. ERBs, obtaining ethical approval from IRBs to ensure that the research meets ethical standards. Relevant guidelines. The Belmont Report outlines ethical principles and guidelines for research involving human subjects, including respect for persons, beneficence, and justice. The American Nurses Association's Code of Ethics also emphasizes the importance of ethical research conduct. How do environmental and occupational health factors impact public health, and what role can APRNS play in addressing these issues? Answer: environmental and occupational health factors significantly impact public health through exposure to pollutants, hazardous substances, and unsafe working conditions. Key aspects include air and water quality. Poor air quality can lead to respiratory illnesses, while contaminated water can cause various diseases. Occupational hazards. Workers may be exposed to harmful chemicals, ergonomic risks, and unsafe conditions, resulting in injuries or chronic health issues. Public policy. Environmental policies directly influence population health, affecting access to clean air, safe water, and healthy food. Role of APRNS at advocacy. APRNS can advocate for policies that protect environmental and occupational health. Education. Educating patients about potential environmental and occupational risks and preventive measures. Collaboration. Collaborating with public health officials and organizations to address environmental health concerns within communities. What statistical analysis methods are commonly used in health research, and how do they contribute to the interpretation of data? Answer: common statistical analysis methods used in health research include descriptive statistics, summarizes data using measures such as mean, median, mode, and standard deviation to provide an overview of the sample characteristics. Inferential statistics allows researchers to draw conclusions about a population based on a sample using methods such as t-tests, chi-square tests, and ANOVA. Regression analysis examines the relationship between variables, helping to identify predictors of health outcomes. E.g., logistic regression for binary outcomes. Survival analysis, used to analyze time-to-event data, often applied in studies involving patient outcomes over time. Contribution to interpretation. These methods enable researchers to make informed decisions, assess the effectiveness of interventions, and identify significant relationships among variables. Relevant guidelines. The American Statistical Association provides resources and guidelines for conducting and reporting statistical analyses in health research. Discuss the importance of immunization guidelines and recommendations in public health. What challenges do APRNS face in promoting vaccination among patients? Answer: immunization guidelines and recommendations are crucial for preventing infectious diseases, reducing morbidity and mortality, and achieving herd immunity within communities. Key points include preventive care. Vaccinations protect individuals and communities from vaccine-preventable diseases. Guidelines. Organizations such as the Centers for Disease Control and Prevention (CDC) provide evidence-based immunization schedules that guide healthcare providers in recommending vaccines. Challenges for APRNS: vaccine hesitancy. Misinformation and concerns about vaccine safety may lead to reluctance in patients. Access to vaccines. Barriers to access, including cost and availability, can impede vaccination efforts. Cultural beliefs. Diverse cultural backgrounds may influence perceptions of vaccination and public health recommendations. Mr. Smith, a 55-year-old construction worker, is exposed to potential toxins at his job site. What steps should you take as an APRN to ensure his safety and promote occupational health? Answer. As an APRN, to ensure Mr. Smith's safety and promote occupational health, you should conduct a risk assessment, evaluate the job site for potential hazards and toxins that Mr. Smith may be exposed to, educate on safety practices, provide Mr. Smith with information on personal protective equipment, PPE, and safe work practices to minimize exposure. Regular health monitoring. Advocate for regular health screenings to monitor for any adverse health effects related to his occupational exposure. Workplace advocacy. Collaborate with employers to implement safer work practices and ensure compliance with occupational health regulations. Referral to specialists. If necessary, refer Mr. Smith to occupational health specialists for further assessment and management. Relevant guidelines. OSHA regulations outline employer responsibilities regarding workplace safety, and the National Institute for Occupational Safety and Health (NIOSH) provides resources for promoting occupational health.